Welcome! Today, we're diving into the world of temporomandibular joint disorder, commonly known as TMJ disorder. This condition affects the jaw joint and the muscles that control jaw movement. Many people experience symptoms without realizing they're related to TMJ. Understanding these symptoms is the first step toward finding relief. In this video, we'll explore the most common signs and how they can impact daily life. Let's start by getting to know the basics of TMJ disorder and why it's important to recognize its symptoms early. The temporomandibular joint, or TMJ, is the hinge that connects your jawbone to your skull. It's located just in front of your ears on both sides of your head. This joint allows you to talk, chew, and yawn. When the TMJ isn't working properly, it can cause a range of uncomfortable symptoms. Understanding the anatomy of this joint helps us appreciate why TMJ disorder can be so disruptive. Let's look at what happens when this joint becomes inflamed or misaligned. One of the most common symptoms of TMJ disorder is pain or tenderness in the jaw. This discomfort can be constant or may come and go, often worsening when you chew, talk, or open your mouth wide. The pain can be sharp or dull and might even radiate to other areas of your face. If you notice persistent jaw pain, especially near the joint, it could be a sign of TMJ disorder. Paying attention to when and where the pain occurs can help your healthcare provider make an accurate diagnosis. TMJ disorder doesn't just affect the jaw, it can also cause pain in the surrounding facial muscles. Many people report aching pain in the cheeks, temples, or even around the ears. This discomfort can make everyday activities like smiling or laughing uncomfortable. Sometimes, the pain is mistaken for other conditions, such as sinus problems or headaches. Recognizing that facial pain may be linked to your jaw joint is an important step toward proper treatment. Another symptom that often surprises people is ear pain or a feeling of fullness in the ears. Because the TMJ is located so close to the ear canal, inflammation or dysfunction in the joint can create sensations that feel like earaches or pressure. Some people even experience ringing in the ears, known as tinnitus. If you have unexplained ear discomfort along with jaw pain, TMJ disorder could be the underlying cause. A hallmark sign of TMJ disorder is hearing, clicking, popping, or grating sounds when you move your jaw. These noises often occur when you open or close your mouth, chew, or yawn. While not always painful, these sounds can be unsettling and may indicate that the joint is not moving smoothly. If you notice these noises frequently, it's a good idea to mention them to your dentist or doctor. TMJ disorder can make it difficult to open your mouth fully or move your jaw from side to side. Some people describe a feeling of their jaw getting stuck or locked in place, especially after yawning or eating. This limitation can interfere with speaking, eating, and even brushing your teeth. If you notice your jaw movement is restricted or you experience locking, it's important to seek medical advice. Some individuals with TMJ disorder experience episodes where their jaw locks in either the open or closed position. This can be alarming and may require gentle manipulation to return the jaw to normal. Locking episodes can last from a few seconds to several minutes and are often accompanied by pain or discomfort. If you experience jaw locking, it's a clear sign that your TMJ needs attention. Chewing can become uncomfortable or even painful for people with TMJ disorder. The jaw muscles may feel tired or sore after eating, and some foods may be difficult to bite or chew. This can lead to changes in eating habits, such as avoiding hard or chewy foods. If you notice discomfort while chewing, it's worth considering TMJ disorder as a possible cause. Swelling in the area around the jaw joint is another possible symptom of TMJ disorder. This swelling can be mild or more noticeable, and it may be accompanied by warmth or redness. Swelling often indicates inflammation in the joint or surrounding tissues. If you observe swelling on one or both sides of your face, especially near the jaw, it's important to consult a healthcare professional. Frequent headaches or migraines are common in people with TMJ disorder. The pain often starts near the temples or the sides of the head and can radiate to the forehead or neck. These headaches may be triggered by jaw, movement, or stress. If you suffer from recurring headaches and also have jaw discomfort, TMJ disorder could be a contributing factor. TMJ disorder can also cause pain that extends beyond the jaw and face. Many people experience aching or stiffness in the neck and shoulders. This discomfort may be due to muscle tension or referred pain from the jaw joint. If you notice neck or shoulder pain along with other TMJ symptoms, it's important to mention this to your healthcare provider. Some people with TMJ disorder report tooth pain or increased sensitivity, even when dental exams show no problems. This pain is often due to pressure from jaw clenching or grinding, which can wear down tooth enamel and strain the supporting structures. If you have unexplained tooth pain along with jaw symptoms, TMJ disorder may be the cause. Fatigue or tiredness in the jaw muscles is a frequent complaint among those with TMJ disorder. This can happen after talking for long periods, chewing tough foods, or even just holding the mouth open. The muscles may feel sore or weak, making it hard to perform everyday activities. Recognizing muscle fatigue as a symptom can help guide appropriate treatment. Bruxism, or teeth grinding, is closely linked to TMJ disorder. Many people grind their teeth at night without realizing it, which puts extra stress on the jaw joint and muscles. Signs of bruxism include worn tooth surfaces, jaw pain upon waking, and headaches. If you suspect you grind your teeth, it's important to address this habit to prevent further TMJ issues. Jaw clenching, especially during times of stress or concentration, is another common symptom of TMJ disorder. This habit can lead to muscle fatigue, pain, and even headaches. Over time, clenching can worsen TMJ symptoms and contribute to joint damage. Being aware of this behavior is the first step toward managing it effectively. TMJ disorder can sometimes cause changes in the way your upper and lower teeth fit together, known as your bite. You might notice that your teeth don't align as they used to, or that your bite feels off. This can make chewing uncomfortable and may lead to further jaw strain. If you experience changes in your bite, it's important to have your jaw evaluated. Some people with TMJ disorder experience ringing, buzzing, or other noises in their ears, a symptom known as tinnitus. This occurs because the jaw joint is located close to the ear canal, and inflammation can affect nearby nerves. If you have persistent ear noises, along with jaw symptoms, TMJ disorder could be the reason. Dizziness or problems with balance can sometimes be linked to TMJ disorder. The proximity of the jaw joint to the inner ear means that inflammation or muscle tension can affect your sense of equilibrium. If you experience unexplained dizziness along with jaw pain or other TMJ symptoms, it's worth discussing with your doctor. Many people with TMJ disorder wake up with jaw stiffness or soreness, especially if they grind or clench their teeth at night. This morning, discomfort can make it hard to eat breakfast or speak clearly. If you notice that your jaw feels stiff or sore when you wake up, it could be a sign of nighttime jaw activity related to TMJ disorder. TMJ disorder can make everyday actions like speaking, yawning, or singing uncomfortable. The pain may be sharp or aching and is often felt near the jaw joint. If you find yourself avoiding these activities due to discomfort, it's important to consider TMJ disorder as a possible cause. In some cases, TMJ disorder can cause the jaw to deviate to one side when opening or closing the mouth. This misalignment may be visible in the mirror and can make chewing or speaking more difficult. Jaw deviation is a sign that the joint is not functioning properly and should be evaluated by a professional. Some people with TMJ disorder experience difficulty swallowing, known as dysphagia. This can be due to muscle tension or pain in the jaw and throat area. If you have trouble swallowing along with other TMJ symptoms, it's important to seek medical advice to rule out other causes. If you find that your jaw feels tired or sore after talking for a while, this could be a symptom of TMJ disorder. The muscles that control jaw movement may become fatigued more quickly than usual, making conversations uncomfortable. This symptom is often overlooked, but can significantly impact social interactions. TMJ disorder pain can sometimes spread beyond the jaw and face, affecting the neck, shoulders, or even the upper back. This referred pain is due to interconnected nerves and muscles. If you notice pain radiating from your jaw to other areas, it's important to mention this to your healthcare provider for a comprehensive evaluation. Soreness in the cheek muscles is a frequent complaint among people with TMJ disorder. This soreness can be constant or may worsen after chewing or talking. The muscles may feel tender to the touch and can make facial expressions uncomfortable. Recognizing cheek muscle soreness as a symptom can help guide treatment decisions. Jaw cramps or muscle spasms can occur in people with TMJ disorder, especially after prolonged use of the jaw. These spasms may cause sudden, sharp pain and can make it difficult to move the jaw. If you experience frequent jaw cramps, it's important to seek advice from a healthcare professional. If you feel pain or discomfort when biting down, this could be related to TMJ disorder. The pressure of biting can strain the jaw joint and surrounding muscles, leading to pain. This symptom may be more noticeable when eating tough or chewy foods. If biting down causes discomfort, TMJ disorder should be considered. Feeling like your jaw is tired or fatigued after eating is a common symptom of TMJ disorder. This can make mealtimes less enjoyable and may lead to avoiding certain foods. If you notice jaw fatigue after meals, it's a sign that your jaw muscles are working harder than they should. TMJ disorder can affect one or both jaw joints. Pain may be localized to one side or felt on both sides of the face. The discomfort can range from mild to severe and may change throughout the day. If you have persistent pain in the jaw joints, it's important to seek a professional evaluation. Many people notice that their TMJ symptoms worsen during periods of stress or anxiety. Stress can lead to increased jaw clenching or teeth grinding, which puts extra pressure on the joint. Managing stress is an important part of controlling TMJ symptoms and preventing flare-ups. People with TMJ disorder may find dental visits uncomfortable, especially when they have to keep their mouth open for extended periods. The jaw may become sore or stiff during or after dental procedures. If you experience pain during dental visits, let your dentist know so they can make adjustments to help you stay comfortable. TMJ disorder can make it hard to open your mouth wide, which can interfere with eating, speaking, or dental care. This limitation may be due to pain, muscle tightness, or joint dysfunction. If you struggle to open your mouth fully, it's a sign that your TMJ needs attention. For some people, even smiling or laughing can trigger jaw pain if they have TMJ disorder. The muscles and joint may be sensitive to movement, making joyful expressions uncomfortable. If you notice pain with smiling or laughing, it's important to address the underlying TMJ issues. TMJ disorder can sometimes cause subtle changes in facial appearance, such as swelling or muscle imbalance. This may result in facial asymmetry, where one side of the face looks different from the other. If you notice changes in your facial symmetry, it's worth discussing with your healthcare provider. Brushing your teeth may become uncomfortable if you have TMJ disorder, especially if opening your mouth wide causes pain. This can make oral hygiene challenging and may lead to avoiding proper brushing. If you experience pain while brushing, it's important to find ways to maintain oral care without worsening your symptoms. Eating hard or chewy foods can be particularly painful for people with TMJ disorder. The extra effort required to chew these foods puts strain on the jaw joint and muscles. If you find yourself avoiding certain foods due to pain, it's a sign that your TMJ may need attention. Chewing gum can aggravate TMJ symptoms, leading to increased pain or fatigue in the jaw muscles. The repetitive motion of chewing gum puts extra stress on the joint. If you notice pain after chewing gum, it's best to avoid this habit to prevent worsening your symptoms. For some, even intimate actions like kissing can trigger jaw pain if they have TMJ disorder. The movement and pressure involved can strain the jaw joint and muscles. If you experience pain during kissing, it's important to communicate with your partner and seek ways to reduce discomfort. Singing can be challenging for people with TMJ disorder, as it often requires wide jaw movements and sustained muscle use. Pain or fatigue during singing is a sign that the jaw joint and muscles are under stress. If singing causes discomfort, consider modifying your technique or seeking professional advice. Blowing up balloons requires forceful jaw movement, which can be painful for those with TMJ disorder. The pressure can strain the joint and muscles, leading to discomfort or fatigue. If you notice pain with this activity, it's best to avoid it and protect your jaw from unnecessary strain. Playing wind instruments can be particularly challenging for people with TMJ disorder. The sustained jaw position and pressure required can lead to pain or fatigue. Musicians with TMJ symptoms should take breaks and consult with a healthcare provider for guidance on managing their condition. Dental appliances like retainers or mouth guards can sometimes cause discomfort for people with TMJ disorder. The pressure or fit of these devices may aggravate jaw pain or muscle soreness. If you experience pain with dental appliances, consult your dentist for adjustments or alternatives. Wearing headphones that press against the jaw or ears can sometimes trigger TMJ pain. The pressure from the headphones may aggravate the joint or surrounding muscles. If you notice discomfort with headphones, try adjusting their fit or switching to a different style. In summary, TMJ disorder can cause a wide range of symptoms, from jaw pain and clicking sounds to headaches, ear discomfort, and difficulty with everyday activities. Recognizing these signs early can help you seek appropriate care and prevent further complications. If you experience persistent jaw pain, limited movement, or any of the symptoms discussed, it's important to consult a healthcare professional for a thorough evaluation and personalized treatment plan.